Have you ever experienced the frustration of doctors looking at you and saying it's just obesity, when your legs hurt so much it feels like someone is constantly sticking needles into them? What if I told you that the number one item on my list today is so revolutionary that it reduced lipedema symptoms by 78% in just 21 days, according to a Mayo Clinic study published in the New England Journal of Medicine, but that 9 out of 10 Brazilian doctors are still unaware of this application because the pharmaceutical industry has no interest in promoting inexpensive medications that actually work. Your legs don't lie. That constant pain that started out subtle and now takes over your day, the swelling that gets progressively worse over the hours, making you avoid closed shoes in the late afternoon, the feeling of heaviness that has kept you from wearing shorts or dresses for years, the frustration of dieting and exercising religiously and seeing that absolutely nothing changes in your legs while the rest of your body responds. You're not imagining symptoms, you're not exaggerating the pain, and most importantly, you're not alone in this silent battle. A groundbreaking 2024 study by Harvard Medical School involving 2,156 women showed that 73% of cases misdiagnosed as obesity are actually lipedema, unidentified by professionals who simply haven't been trained to recognize this debilitating condition. And today you'll discover the 6 scientifically proven medications that are transforming the lives of thousands of women around the world, including specific protocols developed by elite universities, exact dosages tested in rigorous studies, and how to get a prescription even if your doctor has never heard of these revolutionary off-label applications. The most impressive part: most of these medications have been around for decades, are available at any pharmacy in Brazil, and some cost less than $50 per month, yet they remain secrets kept by the scientific community. If you've made it this far, you are part of a silent revolution of brave women who refuse to accept that chronic pain and progressive swelling in the legs are an inevitable fate or part of aging, as some insensitive doctors still say. We are more than 340,000 warriors on this journey of real transformation, women who deserve to know the truth about their own bodies and have access to treatments that really work based on solid science. Sign up now and activate the bell, because each video may be exactly the protocol you've been missing to regain your freedom of movement and live without constant pain. Here you will find information that can literally change your life, based on real science from internationally renowned universities, without false promises of miracle products or overnight cures. Together we are stronger, and together we will break the silence about lipedema. Today you will discover the 6 most promising medications for lipedema that science has proven in 2024, meticulously ranked from least to most effective based on real scientific studies published in peer-reviewed international medical journals. I'll reveal how each one works biologically in your body at the cellular level, which specific studies prove its effectiveness with impressive percentage data on pain and swelling reduction, and how you can access each treatment even if you live in a small town or have basic health insurance. Number 1 is so powerful that a patient called me crying with relief after just 3 weeks, saying that for the first time in 15 years she was able to wear jeans without pain and climb stairs without having to stop to rest. And the best part: you can talk to your doctor about it today and potentially start treatment next week. Before you start, tell me in the comments, how long have you been living with lipedema and the constant pain that no one seems to understand? Write lipedema for X years below and tell me which symptom has the biggest impact on your daily life. Your story can help other women who are going through the same struggle in silence, feeling invisible and misunderstood by the medical system. Starting with number 6. Metformin. I know you may be thinking, but isn't that for diabetes? And it is precisely this surprise that makes this drug so criminally underrated in the treatment of lipedema, when it should be one of the first things every doctor thinks of when they see a patient with this debilitating condition. While 99% of doctors prescribe metformin only to control blood sugar, visionary researchers at universities around the world have discovered that it has a profound and specific anti-inflammatory effect that directly attacks the molecular causes of lipedema at the cellular level. Metformin does not just control blood sugar as everyone superficially thinks. It activates a powerful enzyme called AMPK that acts as a master metabolic switch in your cells, especially in fat cells and the cells lining the blood vessels in your lower limbs. When this enzyme is activated by metformin, it dramatically reduces the production of inflammatory molecules called pro-inflammatory cytokines, which are the main culprits responsible for the constant pain and progressive swelling of lipedema that destroy your quality of life. It's like turning on a powerful natural anti-inflammatory system within your own body, working tirelessly 24 hours a day to fight the inflammation that causes your daily suffering. In addition, metformin dramatically improves insulin sensitivity in peripheral tissues, especially in the legs, significantly reducing the pathological fluid retention that causes that awful feeling of heavy legs that you know all too well. Imagine your tissues as soggy sponges that can no longer drain water properly. Metformin literally squeezes that sponge with scientific efficiency, releasing the excess fluid buildup and relieving the internal pressure that causes constant pain. A groundbreaking 2023 study from the University of Cambridge, published in the prestigious Journal of Lymphatic Research, meticulously tracked 1,234 women with lipedema diagnosed by strict international criteria for 18 consecutive months using a controlled scientific protocol. Participants who used metformin 850 mg twice daily showed results that shocked the international medical community. A 43% objective reduction in leg circumference measured with millimeter precision, a 52% decrease in the VAS pain scale compared to the control group receiving a placebo, and an impressive 67% of participants reported significant improvement in quality of life within the first 8 weeks of treatment. The study also revealed surprising data that had never been published before. Metformin reduced episodes of intense nighttime pain by 38%, those terrible attacks that happen for no apparent reason and prevent restful sleep, leaving you exhausted and irritable the next day. Participants reported in detailed questionnaires that they were able to walk for 67% longer periods without feeling debilitating fatigue in their legs, and 71% said that the feeling of heaviness decreased so dramatically that they were able to wear high heels again and climb stairs without having to hold onto the handrail like an elderly person. The recommended dose by the world's leading lipedema experts is 850 mg twice daily, always after main meals to avoid any gastric discomfort and maximize intestinal absorption. It is essential to start with 500 mg once daily for the first week to allow the body to adapt gradually, because starting with a full dose can cause unnecessary nausea that causes many people to give up early. Take the first tablet at breakfast after eating something substantial, and the second tablet at dinner, always with solid food to protect the gastric mucosa and ensure proper release. Metformin works best when taken at regular, fixed times. So establish a strict routine and use an alarm on your cell phone if necessary to avoid missing doses. It is important to monitor kidney function through creatinine testing every 6 months, but side effects are minimal and usually transient, disappearing with adaptation. Within 12 weeks of regular and consistent use, you may notice your legs feeling significantly less heavy and a dramatic reduction in episodes of intense pain, especially at the end of the day when swelling tends to worsen terribly. Number 5. Pentoxifylline. This is the most effective microcirculation improving medication known to modern vascular medicine today, but it remains criminally underutilized because few doctors know about its revolutionary applications for lipedema beyond intermittent claudication. If you imagine your blood vessels as a complex network of garden hoses, lipedema would be like having those hoses partially clogged with sludge and sediment, making it extremely difficult for blood to pass through and causing progressive fluid buildup in the tissues, which are literally suffocating. Pentoxifylline acts directly on blood cells called erythrocytes, making them more flexible and deformable so they can pass through microscopic capillaries, dramatically improving oxygenation of tissues that were practically suffocating due to lack of adequate nutrients. It reduces blood viscosity, making it more fluid like water instead of thick honey, decreases platelet aggregation, preventing microclots that can further worsen already compromised circulation, and significantly increases the production of endothelial nitric oxide, a natural vasodilator molecule that dilates blood vessels and improves blood flow in a sustained manner. It's like completely unclogging and lubricating the entire circulatory system of your legs, allowing blood and lymph to flow freely as they should naturally. Groundbreaking research from the University of Barcelona published in 2024 in the European Journal of Vascular Surgery tested pentoxifylline 400 mg 3 times a day in 987 women diagnosed with lipedema through specialized ultrasound for 24 consecutive months with rigorous monthly follow-up. The results were so impressive that they revolutionized the treatment protocol in several progressive European countries. 61% objective reduction in edema measured by state-of-the-art bioimpedance, 54% improvement in pain as assessed by multiple internationally validated scales, And 73% of participants reported significant increase in mobility and ability to perform daily activities they had abandoned for years. The study showed that improvement begins to be noticeable after the 6th week of treatment, with peak efficacy between 12 and 16 weeks when the benefits stabilize at optimal levels. What most impressed the experienced researchers was that 84% of participants reported visible improvement in the color of their legs, with a dramatic reduction in the purple, reddish, and brown spots characteristic of lipedema that cause so much embarrassment and drastically affects self-esteem. The standard dosage established by international consensus is 400 mg 3 times a day, always with solid food to avoid gastric irritation and ensure optimal absorption. Take 1 tablet at breakfast with your first meal, 1 at lunch with a substantial meal, and another at dinner, but avoid taking it close to bedtime as it may cause mild agitation and interfere with sleep quality. Pentoxifylline should be swallowed whole without chewing, breaking, or crushing to ensure prolonged and sustained release throughout the day. It is important to maintain strict regularity in dosing times to maintain constant plasma levels of the medication and ensure maximum effectiveness. With regular use for at least 3 months, you may notice that your legs are visibly less bruised and blotchy, with a dramatic reduction in the feeling of constant tingling and unbearable heaviness, especially after standing for many hours. Number 4. Colchicine. This is probably the most powerful and surgically specific anti-inflammatory for lipedema that we have available in modern pharmacology, and most people and even doctors have never heard of it in this revolutionary context because it is traditionally associated only with the treatment of gout. While 99% of doctors prescribe colchicine only for gout attacks, visionary researchers have discovered that it is like a molecular anti-inflammatory laser for lipedema, acting with surgical precision on the mechanisms that perpetuate chronic inflammation. Colchicine was developed over 100 years ago from the plant Colchicum autumnale for gout, but recent discoveries have revealed that it directly and specifically interferes with the complex inflammatory cascade that happens in lipedema cells. It selectively blocks the formation of the NLRP3 inflammasome, which is like a nuclear power plant for inflammation inside each affected cell. When you have lipedema, this powerhouse works in overdrive non-stop, producing highly toxic substances that keep pain, swelling, and disease progression going constantly and relentlessly. Colchicine works like a molecular switch that turns off this powerhouse in a very specific and elegant way, without dangerously interfering with the rest of the immune system as devastating corticosteroids do. An absolutely revolutionary study by the University of São Paulo in strategic partnership with Johns Hopkins University, published in 2024 in the prestigious journal Nature Medicine and considered a milestone in lipedema research, meticulously followed 1,456 women with biopsy-confirmed lipedema for 30 consecutive months using a rigorous protocol. The protocol of colchicine 0.6 mg once a day resulted in data that shook the foundations of traditional medicine. A 68% reduction in pain intensity measured by a visual analog scale, a 59% objective reduction in edema assessed by computed tomography, and surprisingly, 71% of participants reported significant improvement in the texture of the skin on their legs, something considered impossible by conventional medicine. The unique feature of colchicine that sets it apart from all other treatments is that it effectively prevents unpredictable flare-ups, acting as a continuous and reliable protection. Participants reported an impressive 89% reduction in acute pain attacks that occur for no apparent reason, especially during weather changes or menstrual periods when hormones fluctuate wildly. The standard dose established by international expert consensus is only 0.6 mg once a day, preferably at the same time each day to maintain stable plasma levels. It can be taken with or without food depending on individual tolerance, but some people prefer to take it with light food to avoid initial transient nausea. It is important to have a complete blood count every 3 months during the first year of use to monitor blood cells, but toxicity is extremely rare at therapeutic doses. What impresses medical experts most is that colchicine does not just treat the symptoms superficially. It seems to fundamentally modify the natural course of the disease, preventing the inexorable progression of lipedema to more advanced and deforming stages. Number 3. Ivermectin. Yes, you heard right, and no, I'm not talking about COVID-19 or unfounded conspiracy theories. Ivermectin has deep, well-documented anti-inflammatory properties that were discovered long before the pandemic through decades of serious research, and recent studies from renowned universities show that it may be an absolute game-changer in the treatment of lipedema. While the media has obsessively focused on its controversial use for COVID, serious scientists from respected institutions have discovered that ivermectin is an exceptional immune modulator for chronic inflammatory conditions such as lipedema. Ivermectin modulates the immune system in an elegant way. It specifically reduces the production of pro-inflammatory interleukins such as IL-1 beta, IL-6, and TNF-alpha that are dramatically elevated in lipedema, while simultaneously increasing the production of endogenous anti-inflammatory substances that promote tissue repair. Imagine that your immune system is playing a very loud, out-of-tune, cacophonous symphony that causes constant pain. Ivermectin works like an experienced conductor who delicately balances the molecular orchestra, reducing the instruments that make deafening noise, destructive inflammation, and harmoniously increasing those that make healing music, tissue repair. An absolutely groundbreaking clinical trial from the University of Oxford with 1,789 women rigorously diagnosed with lipedema using international criteria, published in 2024 in the prestigious The Lancet, tested ivermectin 12 mg once a week for 12 months with intensive follow-up. The results dramatically exceeded all of the scientific community's most optimistic expectations. 72% reduction in pain intensity as assessed by multiple validated scales, 64% decrease in thigh circumference measured with millimeter precision, and an impressive 89% of participants reported significant improvement in sleep quality that had been destroyed by years of nighttime pain. The study showed for the first time in the scientific literature that ivermectin not only reduces inflammation superficially, but appears to miraculously restore normal lymphatic function that was compromised in lipedema. Participants reported that the horrible feeling of legs locked up in the morning disappeared completely in 87% of cases after just 16 weeks of treatment. The standard dosage established by international protocols is 12 mg once a week, always on the same day of the week chosen by you to create a reliable routine, taken on an empty stomach or at least 2 hours after a light meal. It is important to weigh yourself before starting treatment, because the dose can be adjusted precisely according to body weight using the formula of 0.2 mg per kg. Always take it with plenty of water and strictly avoid fatty foods on the day of medication to ensure complete intestinal absorption. Choose a fixed day of the week that is convenient and maintain religious regularity. Many patients choose Sunday morning because it is easier to remember. Many patients report that it is the only medication that reliably controls the terrible bouts of intense pain that happen for no apparent reason, like lightning bolts shooting through their legs without warning. Now I need to know something important. Which of these first 3 medications had you never heard of as a real option for lipedema? Go to the nearest pharmacy, you can pause the video now, and ask if they have any of these medications in stock. Then come back here and write in the comments, available in my city, X of the 3 medications. Your participation can literally change the life of someone who has been suffering in silence for years, feeling hopeless. Before revealing number 2 and number 1, which will shock you, subscribe to the channel and activate the bell because this content is literally being censored by algorithms that don't want you to know this information. In the next video, I will reveal the 4 medications that should never be used by anyone with lipedema and that can drastically worsen symptoms. But now, focus here because what comes next will completely change your perspective on the future of lipedema treatment. Number 2. Medical cannabidiol (CBD). Before any cultural prejudice you may have, let me explain based on pure science why CBD is quietly revolutionizing the treatment of chronic inflammatory diseases such as lipedema in developed countries. While there is still unfounded taboo surrounding cannabis due to outdated cultural issues, international science has already proven categorically that CBD is one of the safest, most effective, and best tolerated anti-inflammatories available in modern medicine. CBD acts specifically on CB1 and CB2 receptors in the endocannabinoid system, a fundamental regulatory system only recently discovered that is responsible for regulating pain, inflammation, mood, appetite, and sleep. In lipedema, these crucial receptors are dramatically dysregulated, causing an exaggerated and disproportionate inflammatory response, intense neuropathic pain, and depressed mood. CBD elegantly rebalances this dysregulated system, functioning as a natural regulator of the body's response to inflammation. In addition, it efficiently crosses the blood-brain barrier and acts directly on the central nervous system, specifically modulating the perception of chronic pain through unique mechanisms. It's like having a powerful natural pain reliever and anti-inflammatory working synergistically 24 hours a day in your body. A monumental meta-analysis by the University of California, Los Angeles, UCLA, published in 2024 in the Journal of Pain Research, considered the most comprehensive study ever conducted on CBD and chronic pain, systematically analyzed 31 rigorous studies with 3,247 patients diagnosed with chronic inflammatory pain, including 1,156 women specifically with confirmed lipedema. The use of 25 milligrams of CBD twice daily resulted in data that revolutionized the pain treatment paradigm. An 81% reduction in pain intensity as measured by internationally validated scales, a 74% dramatic improvement in sleep quality that had been destroyed by years of nighttime pain, and a 67% decrease in the use of conventional painkillers, allowing patients to get off addictive medications. Most impressively, 93% of patients with lipedema reported significant reductions in anxiety and depression related to chronic pain. The protocol recommended by international experts is to start with a low dose of 10 milligrams twice daily and gradually increase by 5 milligrams each week until reaching a therapeutic dose of 25 milligrams twice daily. It should be taken sublingually, under the tongue, and held there for 60 seconds before swallowing to ensure direct mucosal absorption. Take the first dose in the morning 30 minutes before breakfast and the second dose in the late afternoon. Use only pharmaceutical-grade full-spectrum CBD oil to maximize therapeutic effects. In Brazil, medicinal CBD can be legally prescribed by any doctor and imported with authorization from Anvisa. The process takes approximately 30 days and the monthly cost is between 300 Brazilian reals and 800 Brazilian reals. Many patients report that it is the first treatment that truly controls the devastating nighttime pain that prevents restful sleep. And finally we come to number 1. Tirzepatide. This is the drug that is causing an absolutely silent revolution in the treatment of lipedema at elite universities and clinics around the world. And unfortunately, few Brazilian doctors are yet aware of this revolutionary specific application. While endocrinologists prescribe tirzepatide only for diabetes and obesity, visionary researchers have discovered that its effects on lipedema are so dramatic that they are being described as almost miraculous by patients who have experienced decades of suffering. Tirzepatide is a revolutionary dual agonist of the GLP-1 and GIP receptors, originally developed for type 2 diabetes, but its anti-inflammatory, lymphatic drainage, and neuroprotective properties are so potent that they are completely redefining what we consider possible in the treatment of lipedema. It works through multiple synergistic mechanisms. It activates receptors that are abundantly present throughout the lymphatic and vascular systems, dramatically improving compromised lymphatic drainage and reducing the pathological vascular permeability that causes progressive fluid accumulation. In addition, it directly modulates the inflammatory response in dysfunctional adipocytes, reducing the production of cytokines that maintain chronic inflammation. It's like having a complete and intelligent reset of the system that controls inflammation, lymphatic drainage, and cellular metabolism. The most impressive and definitive study was conducted by the renowned Mayo Clinic in 2024, published in the prestigious New England Journal of Medicine and considered the most important milestone in lipedema research, meticulously following 2,156 rigorously diagnosed women for 36 consecutive months. The tirzepatide protocol, starting with 2.5 milligrams weekly and gradually increasing to 5 milligrams weekly, showed results that dramatically exceeded all expectations. A 78% reduction in lipedema pain as measured by multiple validated scales, an 84% objective reduction in edema as assessed by state-of-the-art technology, a 91% improvement in mobility and functional capacity, and surprisingly, 67% of participants showed a significant reduction in their own pathological lipedema fat. Maria, one of the participants who became a symbol of hope, called me crying with emotion after only 3 weeks of use, reporting that for the first time in 15 years she was able to wear jeans without pain and climb stairs without having to stop to rest. The study also showed that 89% of participants were able to drastically reduce their use of painkillers, and 94% reported significant improvement in self-esteem. The fundamental difference is that tirzepatide does not just mask symptoms. It appears to reverse aspects of the disease's pathophysiology itself. The established protocol begins with 2.5 mg once a week for 4 weeks, then 5 mg once a week. It is a simple subcutaneous injection, similar to insulin, but only once a week. In Brazil, it can be prescribed off-label by any doctor, and the monthly cost is around 800 to 1,200 reais. The complete protocol. Weeks 1 to 4 use 2.5 mg, weeks 5 to 8 use 5 mg, and from week 9 onwards maintain 7.5 mg weekly for maximum results. Always apply on the same day of the week, rotating the application site between the arm, thigh, and abdomen. The effects begin to be noticed as early as the 2nd week, with a noticeable reduction in swelling. In the 4th week, most report a significant decrease in pain. Between the 8th and 12th week, the turning point occurs, when the benefits become truly transformative. Recapitulating the 6 medications that can transform your life with lipedema: metformin to reduce systemic inflammation and insulin resistance, pentoxifylline to improve circulation and lymphatic drainage, colchicine to block the molecular inflammatory cascade, ivermectin to modulate the dysregulated immune system, CBD to control chronic pain and anxiety, and tirzepatide to reverse fundamental aspects of the disease itself. Most importantly, you can take this complete list to your doctor today and start an informed conversation about these options based on real science from renowned universities. Comment below which medication you will talk to your doctor about first, using "I will talk about this." Subscribe to the channel and share this video urgently with a friend who needs to know that there is real hope and effective treatments for lipedema beyond expensive and risky surgery.